It is Health Diary. Thank you for your company. My name is Gladys Gashanja and we're coming to you from Hair Hub, the Trichology Center. Now, they say hair is a crown of every woman. And of course, there's some men who pride to have a good head of hair. But for those that cannot do that, they either are suffering from alopecia or hair loss, as we may call it. And that could be an indication of something else going on with their bodies. So today, we try to understand what exactly alopecia is, and also, is there a cure for it? Well, stay on for answers of these and other questions right after this fact of the matter. Alopecia, or simply known as hair loss, can affect just your scalp or your entire body. There are various types of alopecia which can be as a result of heredity, hormonal changes, medical conditions, or medication. Alopecia areata, which is the loss of hair in patches, mostly occurs when white blood cells attack the cells in hair follicles, causing them to shrink and dramatically slow down hair production. Hair loss can also be as a result of tight hairstyles, which cause traction alopecia, common in women. Some types of hair loss are temporary and others are permanent.
My name is Karen Kinda. I'm 46 years old. I have alopecia. It started 4 years ago. What I noticed was a small patch on the scalp, which I didn't take seriously because I had long dreadlocks and everything seemed healthy. So I didn't take it seriously, but after some time it started getting bigger and other patches developing. But losing hair was not one of the things that I was expecting, and for me it was a shock. At that point I decided to seek other options, other alternatives and other doctors' opinion. It took over a year. I was in waves. So I would always wear, braid part of what was remaining and have a weave, or alternatively just have a wig. Then I got comfortable and shaved all of it and was in wigs for some time. It took, say, about 2 years for me to come to the realization that I've totally lost my hair and it's time to accept. I was hospitalized and was going through steroids injections and, topical and injections. At that time, it's when the doctors were clear that it wasn't reversible, that I'd totally lost my hair, and chances were that it wasn't coming back. We have actually a support group that 90% of us have either lost hair completely or they're just starting to lose hair. What we do in the group is encourage each other, because number one, there's a lot of stigma in this when you have this condition. People have all sorts of comments, people have all sorts of ideas of what you're going through, including cancer, including you've been bewitched and stuff like that. I can say that there's a lot of people that have similar issues, but they're scared to come out. So in this group, we actually try and encourage people to seek a doctor's opinion when you are losing hair, when you experience abnormal shedding, so that you're not suspecting things that are not really there. Well, this happens to both women and men, and it doesn't matter at what age. It can happen even to little children.
The conversation on alopecia, one that will definitely get a lot of heads turning, literally. And to help us have that conversation with me is Noella Opingo, who is living with alopecia. And we have trichologist Muli Musyoka. Thank you for joining me. Now, to start us off, I think we need to clear the air. Who is a trichologist? What do they do?
Trichology is actually two words. One means, tricho means hair, and ology is the science behind hair. So trichology is like a branch of medicine that is involved with diagnosing and treating and helping to treat different forms of hair loss and scalp conditions. The reason why I say helping, treating, there are some conditions that lead to hair loss, but we cannot treat them in a trichology center. We have to send the patient to get more treatment from general practitioners or other doctors. Yeah.
Okay, so what causes alopecia? There's so many science and facts behind it, but it varies from one person to another.
Diet-related conditions to genetics to stress, to diseases, to things like even treatments like chemotherapy and some medication that even for things like acne that can trigger hair loss. So there are many different causes of alopecia, and what is important is really to establish what is happening, because when you look at the form of hair loss and take the history of the patient, then you establish what alopecia is happening to this patient, and then that is the time that you formulate the best treatment to address, or the best therapy to address that particular case.
Noel, you were diagnosed with alopecia at a very young age. How old were you?
I was 14 when it started, but the diagnosis occurred in 2017.
And what exactly was happening with the hair?
It started when my salonist could not do one line, the whole of it, yeah. So I was like, now what is going on? Then the next time it became 2 lines, 3 lines, 4 lines, up to a patch. Now it was like almost covering the entire center of my head. Yeah. At first I thought it was an infection or something, fungal infection. Tried all sorts of medicinal herbs, oils. Nothing was happening.
What were you being told is the problem?
Dr. Mullis told me before even trying to treat the condition, they need to find reasons as to why that hair loss is coming along. Yeah. So the first thing we did were hormonal tests. So he got a bit of history, my health history. So I had anemia, I had hormonal imbalance, so all that was coming, you know, the alopecia now is coming as a result of all that.
Now, hair loss definitely is something that's rampant, but then again, there seems to be a hereditary factor.
Every 3rd to 4th patient we're seeing, there is a bit of female pattern hair loss, which is genetically related, or male pattern baldness. And the other thing is autoimmune conditions, which are stress instigated by stress, but most of them are congenital problems that you must have had a genetic predisposition for that particular condition to showcase.
Are these issues you have in your family? Like there's somebody now in retrospect that you can tell used to have issues that signified alopecia?
My mom actually I used to think maybe I got it from her even before the whole diagnosis. Yeah, she has that condition as well. And I had also an uncle of mine, just small area. So I figured, yeah, it could be hereditary as well. Yeah.
Okay, and you talk about autoimmune diseases. What are we talking about?
The most common we're seeing is something called alopecia areata, where people lose hair in patches and you get very smooth patches on the skin. The beauty about that form of hair loss, if there's any beauty about it, is that the follicles are not damaged at all. So that means when you start treating, then you stand a chance of getting your hair back. It's not a permanent form of hair loss. Then we have other conditions where, for instance, we've been seeing a lot of lupus, erythematosas, and discoid lupus as well. And those are some of the conditions that we're seeing. And there's something else that is becoming rampant called frontal fibrosing. And frontal fibrosing means that the whole front area is affected. For instance, you will see people losing eyebrows, you will see people getting butterfly-like, or doctors would call it malarash. Some of them, it's very easy to diagnose, and others we might need to do a bit of a pathological analysis to really settle on the specific condition that's going on. Before then we start the treatment.
And you talk about your mother having the same condition. Did she have it as young as you did?
I think so, because when I was still in primary, this is way back 2010, going back, she still had that. So yeah.
So she might have had it as young as you did. Yeah. Okay, and did she recognize it when she saw it in you?
No, she didn't.
Maybe the age factor is what threw the mother off, because some people relate hair loss with age, right?
Correct. You call it kipara, you know, in Kenya. I mean, people always say, I'm losing hair because I think age is catching up, or I'm very young, why would I be losing hair? Yeah. And graying of hair, genetic hair loss, we're seeing it even in as young as 17 years old.
Oh,
yeah.
Wow. So they say you typically lose 100 strands of hair daily, something that most people don't notice because it just grows back. Right. But now, when do you start to be concerned? I think that is what our trichologist will be telling us right after this break. Welcome back. It's Health Diary and our conversation, alopecia, or if you may call it hair loss. Still with us, trichologist Dr. Muli. He's a doctor of hair, we shall call him that. And of course, we still have Noella. And they say anyone can get alopecia, but it seems to be more rampant in men. True or false?
I think it's because women cover a lot.
Oh, really?
Cover a lot. Our 50% of the people living on this planet at some point will lose hair. And we are seeing more women, of course, 60-40%, 40 being the men, 60 being the women, because women are predisposed to many different forms of hair loss. Unlike most men who would either be because of stress-related or conditions like folliculitis. You've seen men shave their hair and then they get a lot of bad pimples and on the back of their scalp and all that.
Noella, you talked about hormonal imbalance. At that age, what were you told could be the cause of that?
Before he could even get the whole, diagnosis, I had to do some other tests, yeah. So we did, it's called a pelvic scan, yeah. So they scan your ovaries or something of the sort to really see what exactly could be the problem. So the condition which came out was PCOS. I don't know if you've heard of it. Yeah. So that is what was causing the hormonal imbalance. Yeah.
And we've seen a lot of women, especially after the childbirth and the breastfeeding. There's a lot of association of hair loss and that period, right?
We call it postpartum alopecia. First, things like estrogen, which is a female hormone, very good for hair. Androgen, very bad for hair, which is the male hormone. And that's why when ladies get to menopause, they have the perfect levels of hormones, but their estrogen get dormant. So we start seeing effect of the androgen, which is the male hormone. One of those things will be like thinning at the top area or growing of facial hair. So you shed 1% of your hair every single day, and then that is replaced. And that is a normal hair growth cycle. Now, what happens when ladies are expectant is that the estrogen levels are quite high. So the hair that is supposed to be falling is not falling. And that's why they have thick, full, good looking hair. But after delivery, it takes 2 to 3 months for the hair to move from the growing phase to the shedding phase. The hair fall is because of the shock that happened during delivery and fluctuation in hormones. It should be able to correct itself within 3 to 6 months. If it does not correct itself, then you will need to seek assistance. Number 2, if you did hairstyles that were self-inflicting hair loss, like doing very tight cornrows and all that during expectancy, then after delivery, you've worsened the postpartum alopecia with other forms of alopecia like traction alopecia. So it makes the condition more worse, and most of the people then would not get hair growing back on its own. Yeah.
Okay, so Noella, you underwent the diagnosis. Now you are on treatment. Of course, you're wearing a wig because you're still on the path of the same.
Yeah.
So what exactly is treatment? How does that look like?
Okay, so the first phase after now diagnosis is getting the transplant, yeah, because essentially there are no follicles growing, yeah. So transplant would mean they're extracting hair from somewhere else and implanting it to the affected area.
And somewhere else would be where?
So the extraction is being taken from the back, yeah. So they numb your back, yeah. Once they're done numbing, now they do the incisions as well at the center now where the affected area is, and then now they will uproot the roots, yeah, from the back,
the follicles,
yeah,
yes.
and implant it on the affected area, yeah,
Okay.
essentially. But your head is numb the whole time.
Has it been successful?
Yes, because I can see changes. It was really bad. In fact, going to get your hair done, you have to like think about a style which would not manifest the whole condition.
7 days afterwards, you come for us to do cleaning, where we just remove the dead skin and all that, and then after that nobody can actually tell that you did anything, because where we harvested the hair, the donor side, the little holes that we removed the hair follicles, I mean, they seal within 24 hours, And where we did the recipient side, within 7 days when we do the cleaning, then it looks pretty okay, and you have some tiny little sproutings of hair. But in 6 to 8 weeks, that hair will shed off. And then after that, they start now producing fresh new hair. So 4 weeks past the hair transplant, we do something called a PRP, which stands for platelet-rich plasma, where we draw your blood and we put like a small amount, like 40 mils or 60 mils. We put it in sterile test tubes and we spin it at a very high speed. It separates all the blood components, and we take the platelets because they carry growth factors in the body system. And that is what we deposit in the area that either hair was thinning out or we've done a hair transplant. But within a year, 3 months, you should be having very, very good growth of the hair that was planted.
Losing hair at such a tender age and then having to cover it all your life. Talk about that.
Like, I would not want to undo my hair because I don't want people to see me. If I go to a salon, I do not want anyone to be there apart from just the hairdresser. Sorry. Yeah, so it was really bad. And then in school, people would call you all sorts of names. I was called Kibaki. Yeah, that's funny because I was like, you people do not understand what I'm going through. Yeah. And if you would, at least you'd know how to handle it. Yeah, so it was not a really great journey because people would not understand what you're going through. They don't know what is affecting it. And you just had to find ways of which you could manage. So for me, I looked for, styles which could cover my head. I would look for, and I would long to have certain kind of hairstyles, but because of my condition, I could not. So it has not been a great journey, really. Yeah.
I can imagine. Okay, there are many people watching this and saying, I relate with Noella. What would you tell them is a success rate, or what options are there out there for them?
There are patients who have come to me and I've honestly said, I don't think we can help. So you give them other options depending, because sometimes someone could have a scarring, and a scarring form of hair loss means a permanent form of hair loss, where for instance your own white blood cells kill your own hair follicles, and people keep delaying and hoping that it's gonna get okay, but hoping is not a process. The moment you realize that you're losing hair, there's so much that we can do. There's no form of hair loss in this world that has been said now it cannot be stopped. Some of the conditions might not be reversed, but if you pick any certain form of hair loss in good time, we should be able to stop it, if not slow it down. Even the most common form of hair loss with women of African descent is traction, where ladies are pulling their own hair, and unfortunately you go to, and I'm a hairdresser, so I can say things about hairdressers. Okay. I mean, you go to a salon and a hairdresser tells you if we braid it, it's gonna grow faster. And I mean, that is unbelievable. It's like telling you if you pull your nail continuously, it's gonna grow faster. You're yanking out your hair follicles. It'll cost you your hair. It will cost you your emotions. It will cost you money to restore that hair. Okay,
Noella, this is not for free. And no, it sounds like an expensive affair. How does that look like? And do you have any support, maybe from NHIF, insurance cover?
The time my mom was an employee with an NGO, and as well my dad is a civil servant, he had an NHIF cover. But the two could still not cover it. They were like, this is cosmetic, you need to go see another doctor, and they do not know. I've had this for 7 years. This is when I'm getting the diagnosis, and you're telling me to go see another doctor. Where?
A hair restoration is not one of the cheapest procedures anywhere in the world. Of course, Noella was lucky she was a student, so we have student rates or senior citizens rates. I mean, if we could get insurances coming through and supporting this, I think it's a good thing. It's a conversation that we need to have in different forums and see if something can be done.
What would be your clarion call for people who are around people losing hair, and those even losing their hair, what they should do?
For me, I didn't know close to a decade I could get my hair back, yeah? So there's a chance for you. You just need to go find the right reason as to why that is coming along. It doesn't hurt to just be, you know, lenient and don't be rude to people who are having this condition. Like for me, being called Kibaki, I was like, now why would you do that? You don't even know what I'm going through. You know, in the salon, people even want to come like do a chama. They're like, what is happening with your head? Ukona kipara, why? I'm like, no, don't do that. Yeah.
So they say there are different remedies to getting back your hair, and she tried some, they didn't work. So fact or fiction, rubbing onion or garlic juice on your scalp, does it work or not?
It will burn you. It has too much sulfur. It won't help your hair to grow.
Fiction. Cold green tea.
Fiction.
Almond oil.
Fiction.
Rosemary oil.
Fiction.
Honey perhaps.
Fiction.
Okay. Coconut milk.
It's fiction. It's not true.
Okay.
Yeah.
So we do not have any natural remedies to this.
Most of the oils you're mentioning there ideally would help to moisturize your hair and scalp. The reason why I would actually say almost everything is fiction is because what are you treating?
Okay. Supplements. We've seen many for hair, skin and nails.
It can improve the hair growth depending to what the problem is. If you had a deficiency of vitamin D and you put on supplements with high levels of vitamin D, it can improve. Okay. But you cannot say this one thing is a miracle. So
in short, let's see our trichologist, we understand what the issue is.
That is the bottom line.
Noella Opingo, thank you so much for being candid about your condition, and we wish you all the best. And trichologist Muri Musyoka, thank you for your time. And as you've heard, you've got to see and seek help from a trichologist to understand what exactly is the issue behind your hair loss. Time now for a health tip.
Once every week or every 2 weeks in the worst case scenario, you should be able to get your hair shampooed. And most importantly is to make sure that when you're shampooing your hair, you do not take it in circular motions, because when your hair is wet with water, it stretches up to 50%. If you move it in circular motions and you tangle your hair, it becomes very susceptible to breakage when you're detangling it. And deep penetrating conditioners, or rather what salons will call treatments, is important if it's done after every shampoo process to help strengthen your hair, because deep penetrating treatments will either impart moisture onto the hair or do a reconstructive work on the hair through imparting protein aspects of the treatment into the hair to strengthen it.
Such a great and informative conversation today on alopecia. For all your questions, definitely Dr. Moli, as we call him, the hair doctor, will be here to answer all your questions. Well, it has been Health Diary. Thank you for your company. My name is Gladys Kashanja, and we've been coming to you from Hair Hub, the Trichology Center. Until next time, see you. But yeah, people need to understand. But anyway, it's because it's a medical show or a health show.
Or people standing on their heads.
Yes.
To increase blood. Funga.
You kept saying it. By the way, Moshai, when you do this, if you've noticed, I always do this. I'm not doing it to them. It's you to acknowledge I've seen you.